Organ-specific mistletoe therapy. The first International Integrated Oncology training, including mistletoe therapy in cancer, August 2017, Mumbai. Let's try understanding the relationship between the form and principle. The beauty of nature is basically maintained because of these two very important form and principles. The principle guards the form and form the principle. If you see those beautiful flowers, the blue color, it gels within each other, even though every petal may be different in its look if you look very closely, but still there is a form and there is a principle which it maintains. Similarly, in humans and animals, the whole form and the principle basically begins from the intrauterine life. To understand a deeper understanding of the form and principle, stages of fetal development is the best example. Starting from the first month to the 9th month, you may see a complete change in the form and a complete dominance of the principle which takes over, meaning that the 1-month-old zygote is completely different from a 9-month-old fetus. So there is development of the organs, there is development of various parts, the eyes, the organs, the brain, the spine, and various other parts of the body. But everything is so beautifully synchronized by nature that over a period of time it grows, and if it outgrows the form and principle, then there can be an anomaly. So this can happen. In the disturbance, whenever there is an imbalance between the form and principle, it can give rise to these kind of growths in any particular part of the body. These growths can either be benign or malignant. In benign, there is the form which is again changing, but the principle is being maintained. Whereas in cancerous growths, there is a complete devastation of the relationship between the form and its principle. Let's understand still more deeper of the human organism, philosophically as well as scientifically. The human organism is a well-formed, widely constituted organism whose building blocks are the cells, of course. Now, there are some higher forces or principles of organizations are doing all the building which is taking up, and this balance is a relationship between the form, principle, and the cells, which are the substance. Today, of course, with modern medicine and technology, we know a range of causes which can actually disturb this balance and create conditions for tumorous or cancerous growths. Understanding still deeper aspects, philosophical aspects of cancer, where you see a beautiful painting of a lady, but there is something incomplete, or there was something which has been destroyed. It depends on your outlook, but there is something which is missing. Understanding tells us that on the highest level there is a disturbance of balance which has begun in the creative human spirit. There is something within us which is creating us, and maybe this was not given enough room to unfold. So there is some kind of a stunted growth, or the bodily form is now losing itself. It can become stunted and no longer even maintaining its bodily form. Disturbance can also occur in our soul life in the form of complexes, fears, and obsessions. These influence the harmonious functioning of our feeling life, the bodily basis of which is the rhythmic system of the heart and lungs. Lastly, there is a disturbance in the body's metabolism which is now proved by the modern scientific understanding, basically in the hormonal system, which eventually leads to an emancipation of certain group of cells, very commonly seen in prostate cancers, breast cancers, even adrenal cancers. So these are the cancers, with thyroid cancers, for example. So there is a disturbance in the body's metabolism, especially in the hormonal system, and as a result of which it's giving rise to a group of cells which are now malignant. So let's try understanding still deeper about the abnormal tumor growths. Tumor growth is basically an enlivened part of an organic totality which has emancipated itself from the latter in a way which is known right down to its molecular details, meaning it was a part of the entire organic totality. But now it has separated itself, and which can be diagnosed through the biopsy or through histopathology reports, where it comes down to its molecular details, stating that yes, the cells are completely different from the normal ones. So carcinoma is not just a problem in the cell, but it is in the relationship of the cell with the entire organism. Now, it is very important to see the carcinoma from a complete form and then going right down to the details at the molecular level. On the left side, where you see the doctor staring at the mammography report and trying to find out the extent of the tumor. So it is here where the part is initially withdrawn. It's the same part, which should have defended itself against the abnormal growth. But this is basically happened because of a complete weakened or an insufficiently immune system. But this immune system could not eliminate the tumor, but it is also not the one who has caused it. There is falling apart of the warmed organism. Now, there is a lack of warmth which is seen in these patients, as a result of which there is a part which is falling off, and that's the reason where they say tumors are usually cold. And more importantly, these tumors, they do not even breathe normally. That means there is a death of circulation, there is a death of oxygenation which is happening there, and that is why there is a metabolism of suffocation. So let's understand the therapeutic objective of treating an individual suffering from this kind of a deep disease. Stimulation of self-healing processes in the sick human being, creating something which can actually create a warmth, something like an inflammatory warmth mantle which can be created around the tumor, which aims at dissolving and eventually eliminating it. To achieve an adequate effect, the inflammatory tendencies directed at the tumor should be increased by an appropriate dose until fever reaction sets in. A deeper understanding to the last point is very specific for mistletoe therapy, where there is an inflammatory tendency has to be created by a therapy like mistletoe, in which an appropriate dose has to be given until the fever reaction has set in, and it is this which can actually cause an inflammatory warmth and then further on stimulate the warmth organization, which can actually further on stimulate self-healing processes or forces in the sick human being. A deeper understanding of the relationship of the tumor to the man and the healing process, all of it is clearly understood through anthroposophic medicine, founded by Rudolf Steiner and put into practical applications by Ita Wegman. The anthroposophic philosophy. According to Steiner, he suggested that human beings unite a physical body of substances gathered from the inorganic world, a life body, also called the etheric body, in common with all living creatures, including very similar to the plants. Now, whenever there is a consciousness among the etheric body, we call it the astral body, which is very commonly seen in animals. Lastly, whenever there is the ego, which is the self-awareness, which is completely unique to the human beings. So let's understand the mistletoe and its host tree. Now what in front of you see is the mistletoe bush, which is growing on a host tree. Surprisingly, it has been called a parasitic plant, but in no way does it actually destroy the host tree. On the contrary, botanical studies have shown that the host tree on which the mistletoe grows lives much longer. Now, there were some contrasting views which was observed by Rudolf Steiner. The berries, which basically come in summer, which is pretty natural, but there are berries which are also grown on this plant in the winter. In winter, as you see that there are post-autumn, there is completely shedding of the plants, and the temperatures are in sub-minus degrees, and that's not the time when any plant would actually give out a berry. But in a mistletoe, that is the time when the fruit actually comes up. Now, this contrasting developments of the plant in summer and the winter brought complete deeper understanding of cancer with Rudolf Steiner, and that is where he suggested the use of the berry extracts by Ita Wegman, and the first injection or the first application for cancer was developed way back in the early 19th century. On the left side, you see is the Ita Wegman and Rudolf Steiner. Now, the science of knowing is what is understood as the epistemology. On the basis of his spiritual scientific investigations, Rudolf Steiner recommended mistletoe for cancer therapy, and that was first put into practice by Ita Wegman. This occurred without actual double-blind experiments on man and animal, but only with spiritual scientists' intensified and direct capacity of insight into the relation of this special plant to the pathology of the human organism. What this insight reveals is that mistletoe develops a special form of etheric activity which expresses itself in a regular rhythm which is opposed to the growing rhythms of the rest of the plant world. Now, times have changed. Technology can be brought into medicine, and so the biological and pharmacological properties of the berry extracts, or called the Viscum Album extracts, can now be studied. Now, the most important berry extracts is what is seen are the mistletoe lectins, the 1, 2, and the 3, viscotoxins, oligo and polysaccharides, and lipids. Now, the most important properties, or the most striking properties of the Viscum Album extracts are the cytotoxicity and the growth inhibitory effects on tumor cell lines, and that has been studied in vitro. The cytotoxic effects of Viscum Album extracts mainly caused by the apoptosis inducing mistletoe lectin, while the viscotoxins, as you know, the name suggests, can actually cause a necrotic cell death. So there is an apoptosis inducing mistletoe lectin. On the other hand, there is a viscotoxin which can actually cause a necrotic cell death. But with this dual function, there's a triple function which also says that the Viscum Album extracts are known for its immunomodulating effect. In vitro and in vivo, they activate monocytes, macrophages, granulocytes, the natural killer cells, most important to recognize and kill cancer cells, the T cells, and induce various cytokines. On the contrary, apart from causing the necrotic cell death, the apoptosis, which is again mistletoe lectin induced, it actually stabilizes the DNA, so it reduces chromosome damage and it improves DNA repair, one of the most important features in breast cancers. Choice of host tree in organ-specific cancers. The European mistletoe preparations in India as well as the Asian countries, the most common which is available is the Iscador and Helixor. So let's try understanding the series and the preparations which are available. In Iscador, you have the QU, the M, and the P. In Helixor series, which is available, is the A, M, and P. Throwing some little light on the clinical application of the mistletoe therapy, the Viscum Album extracts. It basically, what is available in the Asian countries are the different type of series. Starts from series 0, then it goes series 1, series 2. Series 0 basically has about 0.01 milligram. On an average, I've written 0.1 milligram to 1 milligram, which is considered to be the starting phase of stimulation of the immune system. So it starts with series 0 with a lower dose, further goes on to the maintenance dose, which is series 1, which the dosage is from 1 milligrams and it ranges up to 10 milligrams. Further on, it goes up to maintenance phase 2, which is series 2, 10 milligrams to 20 milligrams. Now, there is a difference between maintenance phase 1 and maintenance phase 2. In both series, the dosage is completely different. It's 1 to 10 milligrams in the first, as well as in the second, it is 10 to 20. Now, unless and until there is no immune response, you go back to the second or the maintenance phase. But if there is a good immune response, which is seen in phase 1 itself, or a stronger response which was seen in phase 1, then the particular dosage of phase 1, which is continued for a longer period of time. And this is the application of how mistletoe can be applied in cancer patients. Talking again, it's the induction phase 0, 1, and 2. If there is a good immune response in 1, then 1 is carried on further. If there is no immune response, then the phase 2 is started and carried on further for a longer period of time. So let's understand the Iscador preparation. So now let us understand the Iscador host tree application and its different preparations. The three basic preparations available in Asian countries are Series QU, Series M, and Series P. Series QU, made from the oak tree called the Viscum quercus, clinically applicable to male patients. Series M, Viscum mali, from apple tree, clinically applicable to female patients, premenopausal. Series P, Viscum pinni, which is made from the pine tree mistletoe, clinically applicable to female patients, especially postmenopausal and certain clinical conditions of male patients. Now, the clinical applications to male patients or female were premenopausal or postmenopausal was again deeply incited by Rudolf Steiner, where he compared the oak tree very similar to the man, the apple tree, which is again a fruit-bearing tree, which is commonly seen in female patients who are premenopausal, and Viscum pinni, where you see the leaves which are very sharp, and so compared it to a female who's especially in postmenopausal. So these were the insights, and then it was clinically verified, and this has been carried on for a long time, and clinically there are good results using these particular series in these mentioned. But again, it again depends on the clinician treating the patient. So it again depends whether you would like to use quercus or Viscum mali or pinni, and then there can also be a change in series whenever the clinical condition demands. Let's understand the organ applications of the quercus in, commonly as I said, it's in male patients, in gastric, that is the buccal mucosa, tongue, esophagus, stomach, duodenum. In hepatobiliary would be the liver, gallbladder, the pancreas, intestinal, jejunum, colon, rectum. Urogenital would be kidneys, urinary bladder. Male reproductive, the most important, penis, prostate, and the testes. Respiratory and endocrine, respiratory, the most common is the bronchus, as well as the bronchial tube, and the thyroid gland. Now these are the organs which, when get affected with cancer, a series of Iscador QU in male patients can be applied. As I talked before, these Iscador mali or Iscador M, which is again given premenopausal. Gastric, again the same features of the QU, which again involves the buccal mucosa, the tongue, esophagus, stomach, duodenum. Hepatobiliary, again liver, gallbladder, pancreas, intestinal, jejunum, colon, rectum. Urogenital, kidneys, urinary bladder, female reproductive, premenopausal. Breast cancers, cervical cancers, vaginal cancers, uterine, and ovaries. Respiratory, bronchus, and the thyroid gland. Now, even if there is a metastatic changes, what is seen is that the primary tumor from where it is arisen and the particular age of the patient, whether it's premenopausal or postmenopausal, has to be considered and the preparation applied. Lastly, understanding the Iscador pinni, which is of the postmenopausal age, the gastric, the buccal mucosa, stomach, the tongue, esophagus, stomach, and the duodenum. Hepatobiliary, which includes the liver, gallbladder, pancreas, intestinal, jejunum, colon, rectum. Urogenital is kidneys, urinary bladder. Female reproductive, which is any cancer which is affecting the breast, cervix, vagina, uterus, ovaries, but postmenopausal. Now let us also see something which is common between the postmenopausal and the male patients. Now, upper respiratory, especially the nose, the pharynx, the oral and nasal and larynx. Now the oropharynx and the nasopharynx tumors, which the most common application which is tried and tested is the Iscador P. The lower respiratory, especially involvement of the pleura, the P series, skin, melanomas, P series again, sarcomas, the bone, muscle rhabdomyosarcomas, as well as most importantly the hemopoietic, the lymphomas and leukemia. With caution, brain and brain metastasis, again where P can be used, because at times their patients may be visiting us at a stage when the brain and the brain metastasis requires a deeper treatment, where Iscador P, which is now available in the oral drops, which can be applied in brain metastasis, but in the others, including the respiratory, the skin, the sarcoma, the hemopoietic system, Iscador P injectables can very well be applied. Now let's try understanding the other preparation, the Helixor. Now the Helixor again has the three varied series which are commonly available: the Helixor A, Helixor M, and Helixor P. Helixor A, which is made from the fir mistletoe, Mistletoe abatis. Helixor M, very similar to Iscador, the apple tree mistletoe, Viscum or Viscum mali, and Helixor P, which is again penny, which is the pine tree mistletoe. Now, Helixor A is again preferably administered to male patients, not necessary. The next slide will tell you about the differentiations of the applications. Helixor M, again preferably administered to female patients. There is nothing like premenopausal, postmenopausal, but female patients it's basically preferred with Helixor M, and especially with the picnic constitution. And Helixor P is for individuals with the asthenic constitution. Basically, Helixor and the clinical practitioners basically follow this slide to great importance, where Helixor A, which is the fir mistletoe, Mistletoe abatis, basically has a gentle stabilizing therapy, where especially which is seen in post-chemotherapy, especially if the patient is very sensitive to preparations, to drugs, then the best thing is to start with a gentle stabilizing therapy and then going up to something which is more powerful, which is the Helixor M, the apple tree mistletoe, which is the Viscum mali, which is more powerful. It also has potent tumor inhibition properties. It stimulates the immune system to a large extent. And still more is the Helixor P, which is again made from the pine tree mistletoe, where there is a complete bone marrow stimulation. So these are the various clinical applications of Helixor, and you will see the further slides much more deeper organ applications of the preparation. Organ applications of Helixor. Helixor A, the gentle immune stimulus, especially if preferable to the male patients, which is again philosophical in its approach, but the most important is if patients are sensitive to certain reactions, then yes, Helixor A can be started, especially in tumors affecting the gastric, again the esophagus, stomach, duodenum, salivary gland, most important, hepatobiliary, where you have the liver metastasis or the liver affections, gallbladder, bile, pancreas, small intestines, as well as large, the anus and the colon, urogenital, kidneys, urinary bladder, male reproductive, the penis, prostate and the testes, ENT, respiratory, endocrine, as basically involving the pharynx, the larynx, the lung, the pleura, and most importantly is the thyroid gland. Helixor M, as I said, it has a very potent immune stimulus, can be applied in gastric carcinomas, again with the same parts involved, the esophagus, stomach, duodenum, salivary gland, hepatobiliary, again liver, gallbladder, pancreas, intestines, urogenital, again kidney, urinary bladder. But female reproductive, most importantly is Helixor M, which can be again used for breast cancers, uterine, vaginal, ovarian cancers and cervical cancers. ENT and respiratory and endocrine. In respiratory is the most important is the lung and the pleura. In ENT is the pharynx and the larynx. So in females, it's not necessarily whether it's premenopausal or postmenopausal like these Iscador preparations. Helixor M can actually be just readily started with these patients at any stage of the disease, and it's a very strong immune stimulus, so it can be immediately started unless and until patient is very sensitive, so the initial series or series A can be started. Helixor series P, which has a potent bone marrow stimulus. Most importantly, bone marrow stimulus is very much required in blood cancers, especially leukemia and chronic lymphatic leukemia, lymphomas, which are again Hodgkin's lymphoma, sarcomas especially, even with female breast cancers, where there is a strong stimulus for the bone marrow required to completely develop the warmth, organization, as I told you before, and the fever response has to come. So in case where the M series has not worked on well, maybe the patient can be switched over to series P and a good strong immune stimulus can be achieved. Male reproductive testicular cancers. Now this is something which is very important. Treatment giving doctors, the conventional measures are to be used if necessary, or I would say yes, there is a medical legal aspect to everything, so please be careful when implementing certain therapies by not refusing the conventional measures. Now they can also include operations, that means surgery, hormone therapy, chemotherapy, radiation when absolutely necessary. But these therapies can actually go hand in glove with any kind of modern medicine treatment without causing any hindrance to the therapies. Especially for an anthroposophical doctor, is always a conventional medical doctor or a doctor who's been specialized in different other schools of medicine, but his only aim at an alternative medicine would be like an extension of the medicine in which he studied in the sense indicated. He practices this extension to the extent that this is possible under the present conditions of what the patient has. Lastly, medicine is an art, and natural science and spiritual science furnish its elements. The bibliography is from the Iscador manual, the Helixor manuals, Rita Lurva notes on mistletoe therapy in cancer, the Bombay lecture. It's all available on the net. Anthromed library, again details of the philosophy of the cancer, very classically written up by Peter Heuser, Iscador by Kian Kasad, and of course other literatures from the Rudolf Steiner books. Enjoy the beautiful scene, and please integrate these therapies in such a way that you can bring in a change in lives of these cancer patients. Thank you.